Thank you. So the topic of my presentation is the COVID related to COVID-19. So it is focused on nutritional challenges and strategies amid COVID-19, and I will give you an international perspective in that regard. So starting from the sorry, I will just go through different details. Like first, I will present you a little bit about the context of this COVID-19 and the different nutrition strategies. I will talk about little about the different nutritional patterns or food systems which are being implemented around the globe. And at the end, I will go through the nutritional challenges which are being faced by the world before presenting strategies or recommendations towards the end. So if we go through the current status, at the moment, the latest figures show that we have almost 27 million persons who are affected with this global pandemic. And there are, which has resulted in almost 0.9 million deaths around the globe. Still, there are about 20 million, 19 million people who are still affected by this pandemic, which was declared as the emergency by WHO. Initially, it started from a cluster which was reported in summer 2019. And reports predicted the onset of possible coronavirus outbreak, which is called as SARS-CoV-2, severe acute respiratory syndrome. So that was declared as a global health emergency by WHO. So if we consider the previous outbreaks, number of studies have been reported as we consider the nutritional status. There were previous studies where the researchers have worked on different nutritional strategies and nutritional patterns or diet patterns, keeping in view the different outbreaks. So since this outbreak since 2019, different individuals and community have been submitted to there is development of community resilience, and most of the countries, they focused on the herd immunity or the resilience of the community, which is considered as the main source while remaining which was considered as first line of defense in emergency preparedness. And later on, they also focused on the different behavioral and psychological countermeasures of both the individual and the community. So they consider that there are different vital determinants to improve the resilience and enhance the effectiveness of the people against this pandemic. So keeping in view the nutritional status, which is considered as one of the important aspect of individuals' resistance or immunity against the different types of infections, including COVID-19. One of the factors which can be considered as the keeping in view the international prevalence, as Dr. Shehzad has already explained, the prevalence of different malnutrition practices or the inadequate dietary patterns or lifestyle changes has resulted in number of nutrition disorders, including the obesity, diabetes, and number of micronutrient deficiencies. So the basic reason behind all these deficiencies is inadequate nutrition, which can have long-lasting effects, and definitely they are linked with the health. One of the main reasons behind all these nutrition factors are the poor diet and the physical and mental health. So that's why the optimum nutrition is considered as important factor to control these disorders. So that's why all these nutrition challenges and strategies become important while we talk about the COVID-19. So in this context, I will present you all these nutrition challenges and different strategies which are being implemented at various levels around the globe. First, I will start with the nutrition and immunity. At the individual level, while we consider there is a common denominator that drives most of the dietary recommendations, to combat the viral infections, including the COVID-19. And the link between diet and immunity is the basic link which can affect the overall immunity level. It can help to combat the viral infections. Just so it is considered that the basically immune system, particularly for elderly people or the people which are already suffering with the various type of ailments, they are more vulnerable to disease susceptibility. Therefore, specific nutrients or nutrition combinations may be used to tackle those disorders for particularly vulnerable group like elderly people and pregnant women, etc. So basically, what nutrients can play, they can activate the different cells, and they modify the production of some chemicals which can help to tackle the attack of different viral infections, and it can also help to express various types of genes which are important during such pandemics. If we consider different types of dietary ingredients, so there are different determinants which play a role and which can be controlled or which can be balanced by using a balanced diet. So in that aspect, gut microbial composition and its shape plays an important role because it has to characterize the immune response in the body. And the different types of nutrients, basically when we talk about the immunity, we talk about the vitamins and minerals. So globally, because they can provide energy, they can provide protein and definitely specific nutrients. If we talk about the Southeast Asia, particularly Pakistan, we are facing number of deficiencies even in elderly people or adults. There are a number of deficient micronutrients. A number of studies are going on. So few of those vitamins and minerals which are important and considered to contribute to the immunity are iron, zinc, vitamins A, B, and particularly vitamin C, which can help to boost the immunity. So the key to maintaining an effective immune system is to avoid the nutritional deficiency which are being faced by the world. So on March 3rd, 2020, WHO presented different guidelines for persons, particularly for those persons who are diagnosed with non-communicable diseases, and they consider that those people are susceptible to develop the COVID-19. So they have segregated two different types of people: those which are affected with non-communicable diseases and those which are at the risk. So there are a number of people, for example, those people which can be affected with the COVID-19, mostly elderly people having an age of 60 plus, and the people which are facing pre-existing non-communicable disease, like there are a number of diseases they have considered, like CVDs, in diabetes and cancer. On the other hand, the risk factors, they have mentioned certain risk factors for the people who could be considered as the people which are vulnerable to become severely ill with COVID-19. So the first I will talk about the smokers are particularly likely to be more vulnerable to COVID-19. Possibly because it's a respiratory syndrome, so most of the time it is considered that most people who are habitual smokers, they are more vulnerable to the COVID-19, and the conditions that normally increase the oxygen needs are we can say that they can reduce the ability of the body to use it properly, will put patients at high risk of the COVID-19. So in that context, we can say that nutritional status also has a significant impact on individuals' overall health. And there comes two type of questions. Is there an evidence-based therapeutic or treatment strategy available to prevent the incidence or severity of the COVID-19 infection? The answer is no. as yet, there is no evidence-based therapeutic measure which has resulted to control the COVID-19. There are theories, but they are mixed, but still there is no evidence-based research which can be helpful to prove this theory. And the second question is whether there is a single food or natural remedy or superfood, you can say, to prevent COVID-19 infection. The answer is again no. At the moment, we don't have a single food which can be helpful to tackle the COVID-19. Yes, you can improve your immunity with number of diets. Various diets are available which can be helpful for the people to improve their immunity. So in this way, if we consider the diets, so nutrition status is definitely important when it comes toward the patients or the healthy people. So nutrition is well placed to have a key role in the challenge of keeping healthy people healthy, and also the patients to provide them optimum nutrition. I will just cite two types of diets here just to present you comparison. One is the Mediterranean diet and the other one is the Western diet. Normally, Mediterranean diet, there are various patterns which are linked with different conditions or the respiratory diseases. Mediterranean diet normally is characterized by the presence of high dietary intake of minimally processed fruit and vegetables, legumes, olive oils, whole grain nuts, and some types of monosaturated fatty acids. And it also encourages the use of some fermented products, and to the limited extent the fish and the meat, like red meat. So a balanced diet rich in these foods is associated with inflammatory and immunomodulatory compounds, including some sort of essential vitamins, particularly vitamin C and E, and number of minerals which can be helpful to improve the immunity. Overall, there are a number of benefits of Mediterranean diets, which includes the presence of much of the benefits, like the presence of bioactive compounds, which are considered as important from all aspects of the diet, and relatively low intake of overly processed foods with limited negative health effects as compared to other diets like the Western diet. So on the other hand, when we talk about the Western diet, which is being practiced by a number of developed countries, it is normally characterized by presence of or a high consumption of processed foods such as refined sugar, cured and red meat, desserts, and sweets. Normally, they tend to use the foods high fat products. So resultantly, there is high intake of saturated fats and sugar and refined carbohydrates that may be associated with different disorder like hypoglycemia and hyperlipidemia. So consequently, there is a high prevalence of type 2 diabetes and obesity, which can be considered as a risk factor and lead to the development of severe COVID-19 complications. That's why we can have a general pattern around the world that the people, most developed countries who are consuming these type of diets, they tend to be affected more severely by this pandemic. Particularly, I quote you the example of Europe and all those countries who are focusing these. The most common example is of US, which is severely affected by the COVID-19. So we can conclude here that nutrition plays a major role, and diets pattern or different types of diets and lifestyle has an important role, and it can be helpful to tackle to some extent the COVID-19. Now I will move towards the different challenges and propose some strategies. I will divide into 4 different components. We are facing different challenges at individual, community, national, and global level. If we talk about the different individual challenges, Normally, there's a new set of challenges for the individual to maintain a healthy diet, particularly keeping in view the state of lockdown, which was announced by many governments around the world. And there was severe repercussions on the both access and the utilization of the food. Definitely that type of confinement in different countries had direct effects on one's lifestyle. There was a significant change in dietary habits, eating habits and physical activity patterns of the people. It resulted in an increased sedentary behaviors leading to due to the activities there was little energy consumption, and mainly they perform different type of activities. Like most of us have worked online for to take our classes, and likewise many people have transformed their daily routines, and there was a significant rise in sedentary behaviors around the globe. So it also increased the prevalence of low physical activity, because people were confined to their homes, and they were not able to go out to perform their physical activities during that time. Definitely, it's linked with the overall health and physical development for the persons who are at the growing stage, particularly for the kids around 11 to 17. And ultimately affecting the overall health of the people. So we can say that this lockdown has encouraged the, sorry, I'll just plug my laptop. So this lockdown and confinement has resulted in irregular eating patterns, and there were, due to the frequent snacking, there was higher caloric intake and increased risk of obesity. On the second thing, which is related to the this change in dietary patterns, it is driven by the fear and anxiety many people around the globe are experiencing. There was no guarantee that when it will end, and still we have no surety or guarantee that when will this pandemic end. Because every country, most of the countries, like I will quote you the example of France, we are facing here a second wave, which is more severe, although there are a number of other factors also, but nutritional status of the individuals is also playing a key role in that immunity, which is being practiced and being offered by people who are vulnerable, particularly the elderly people. So due to this fear, definitely there is change in dietary habits, which are affected by different conditions of stress, distress, and emotional disturbance, which can lead to the unhealthy patterns and poor quality of the diet. One of the study earlier, they proposed a 5-way model of emotions and diets, which are particularly helpful in this scenario, and which can play an important role in changing our dietary pattern or the eating habits. So changes in food take may be the natural response to stress and heightened emotions, and they have proposed a 5-way model to control those emotions and improve your eating habits. The challenge at the community level we are facing is the food access and availability. Definitely, I myself did the same thing. When there was announcement about the pandemic, we rushed to the superstores to stock our groceries, particularly food and water. And it becomes difficult for the people who are not hoarding the food. So the term which is being practiced is food hoarding, that you are going to fill your freezer with all type of food you can have for 1 or 2 months, and this can have an indirect impact on the food supply chain by changing the consumer behavior. And definitely there is the people are forced due to uncertainty and volatility. There was increase in consumer demand for particularly food commodity, and many of us have observed the lack of or the availability of the food items in the store. There was a problem around the globe, and also considering those countries who mainly depend upon the importing food items, it was difficult for them due to the closure of the borders to import food items from different countries. So people hoard more than they need and pose devastating consequences on those people, particularly who are at risk. This resulted in extreme shortage in markets and also ultimately leading to the rapidly rising prices. So it was a crucial because there were rumors, that social media nowadays it plays an important role, and different type of news they spread around, and there was a panic buy which resulted in these type of conditions. And for community, if we can talk about the older and adult patients, adult people, they are considered as most vulnerable due to nutrition imbalance. And one of the study by WHO have showed that adults having 60 years or plus age and patients which are having pre-existing medical conditions, this COVID-19 was even more severe for them, and we have witnessed a lot of deaths in Europe, particularly Italy and France, which have Italy is considered as the country having most percentage of the elderly people. So there are a number of deaths in Italy, which when the COVID-19 started in March, April, and May, we have witnessed number of deaths of elderly people. And same has happened in France, and likewise all other countries who are severely affected. There are a number of deaths of elderly people who are facing pre-existing condition. Then the recommendations to stay home by the government and social distancing also targeted these specific group of vulnerable people. And due to malnutrition or the limited access to the food, they were susceptible to malnutrition also. Conditions are some little bit different as we compare Pakistan or the eastern countries, particularly South Asia, with the western countries. The elderly people now, they are independent, more independent than as we compare with our combined family system in Pakistan. Normally the elderly people are taken care of by their family members, but here the situation is different. So it was difficult for elderly people, those to maintain, even to go for purchasing their food items. Access was limited for them. So there were different organizations who extended their assistance in food access and availability, but situation was not easy for them. Coming towards the challenges being faced at national level around the globe, the most important thing was the stress and the load on healthcare system. So different countries have dealt with this aspect with their capacity and resources, but this has resulted in destabilizing the economies, and it was considered also as a rising threat which can contribute to the food insecurity. This challenge, which to provide the adequate nutritious food at times of pandemic, it is defined in the sense that there is a need of more finances, and there is a need for the governments to provide an equal access to all the communities, all the people. Rather, number of countries have taken different initiatives. Like in Pakistan, they have distributed very recently. Through social media, I've got the info that they have distributed different rations at Punjab level, might be at federal level. So likewise in other countries, the government has ensured that their people get the optimum things, the at minimum food, which should be considered as important for the healthy living. And also the challenge was to promote the use of local agricultural produces, which are normally being ignored due to different reasons. And this has helped to minimize the reliance on food imports. But for the government, it was a challenge to go for a significant planning action. Significant reforms were needed by the government. They have formed different policies in order to tackle the issues related to the production, distribution, and access of this food basket to different communities. And different countries have offered tax waiving for the staple foods and commodities. Talking about here in France, they have certain social security system, and through that system they help the people who were below a certain level in terms of their resources, and they help to provide them all the basic necessities. And there was a challenge for the governments to mobilize the resources in order to finance those food purchases for the people and ensure their provisions at the appropriate time. And also because there was no import due to closure of border, so they helped the agriculturers to promote their production and also the food industries to work and ensure the supply of the food commodity to the population. So now coming towards the last aspect, that the global challenge. So the most important thing was the border closure. So due to a number of reasons, so every country tried to receive the persons from the other countries due to this border closure. And at the beginning of 2020, almost 135 million people faced food insecurity due to the border closure. And it is estimated that by the end of 2020, this number could increase to almost to 65 or to 70 million who can face the food insecurity due to border closure. And the countries, particularly as I've already cited, that those countries who were mainly heavily depending on the imported food to meet their basic demands, they faced an inconsistent risk from of the supply of these commodities, and there was supply chain failures for those countries. It was impossible for the country to maintain a smooth flow of the global trade, and also it was impossible for them to make full use of the international markets to secure the food supply across the globe. So we can say that COVID-19 relates to its global nature, whereby no country is immune to its spread and infliction. It was a global threat so that's why it requires a global action. Now coming to our strategies, our recommendations. In the sequence, I will talk about the strategies at individual, community, national, and global level. For individual, what is important and what we need to follow? We need to follow a well-balanced diet which is high in fruits and vegetables, which is enriched in vitamins, particularly vitamin A, C, E, and B6 and 12, and different micronutrients, which are differently available from number of different sources. I hope that as I'm talking to the food technologists and nutrition, they are very well aware with these sources of different vitamins and minerals. We need to maintain a healthy lifestyle of exercise in order to avoid that sedentary lifestyle, because I have mentioned that we have witnessed a number of countries where the second wave is in process and we are not sure when it's going to end. So For the people who are continuing their activities at home, it's highly recommended to continue the home exercises in order to avoid that effect, and that can lead to obesity, and later on it can lead to different nutritional disorders. One of the presenter has already talked about smoking, alcohol, and drugs. So definitely these type of habits can promote this. Actually, they weaken your immune system, and they can lead to the development of different disorders which are related to the nutrition also. When you are going to follow to avoid a sedentary lifestyle, and you're going to follow the exercise or home exercise pattern, definitely you are going to control your weight, which is important. And the most important thing is to get an adequate and full amount of sleep and meditation. Sleep is very important. It is recommended that around 8 hours of sleep is considered important or healthy for your daily activities. So there's a collective responsibility which falls on the individuals related to the social media. So we need to avoid the spread of misinformation, particularly which is related to the nutrition and dietary intake related to the COVID-19. Number of social media networks, they are flooded with the messages of single food, superfood, or herbs. They are promising cure or prevention of the infection. The thing which I have cited earlier, which that there's no evidence-based therapy which has yet been reported to control COVID-19 particularly. Yes, I have cited that you can improve your immunity in order to be safe in current pandemic, but there is no single food which can be considered as the cure of the COVID-19. So we have to avoid the negative implications, ranging from giving a false sense of protection against infection to the toxicity. On the community level, we need to spread awareness regarding the devastating consequences of hoarding or panic buy. So we need to avoid, we have to take care of each other. That is difficult, but we have to, because we are sharing resources, we are living on the same earth, and we have to share resources with the fellow human beings. So awareness, the need of spreading awareness in this aspect. We need to identify and support populations who are at risk of malnutrition within the community, particularly the people with prevailing conditions and elderly people. And we have to create a structured and reliable support system to tackle this pandemic. And later on, in terms of community nutrition, there is need to ensure availability, access, and affordability of essential food commodities to all the members of community through a structured and reliable support system. Reliable means that persons who are delivering the food, normally we have a number of different organizations in Pakistan, also around the globe. There are a number of NGOs who are working on front footing in this pandemic, and they are providing basic necessities to the people. But the system is reliable means that the things they are distributing, they should reach the targeted population. At national level, there is need a paradigm shift. So what does we need to do at national level? Like governments, they need to do they have to perform different coordinated efforts of different entities which involve different public and private sectors, international agencies, which can also include the donor agencies, the NGOs, and particularly local communities, because the local communities are the better integrated people, and they can better deliver, they can help to form that structured, reliable system in order to deliver those food commodities to the people who are actually in need of those food items. There is need to build a communication and effective communication and information strategy. Particularly, there should be public awareness campaigns in order to promote the nutrition education and particularly nutrition guidelines by our different academia and research organizations, different forums through social media, and it can include number of different platforms which can help the people to get awareness about nutrition to be followed, and particularly to the nutrition to be followed and the foods to be avoided during this pandemic, and also to the foods can improve the immunity of the people. The last challenge which I have discussed earlier, the strategies related to the global nutrition is we have to ensure globally, we have to ensure global trade. Most of the countries have opened or partially opened the borders, which has ensured the supply of food, particularly for those countries who are relying on the import of the food items. And the governments, they need to avoid any trade restrictions in view of this pandemic, which can be definitely beneficial to keep food and feed supplies, because feed supplies are also important for the production of food, and particularly the meat items. And also the agricultural imports, they are considered important for the production for the farmers, for the production of food items, which is considered an important response measure amid this COVID-19. And one of the strategy which can be implemented by the governments at global level is to reduce import tariffs and other restrictions on different types of food commodities. So if we conclude, definitely there is much to do at the moment, and we need to know a lot of things about COVID-19, particularly when we talk about the nutrition and dietary intake. Definitely nutrition status or the amount of intake which you are having, your nutrition status can have a significant effect on health, because it is related with your immunity system. It can boost your immune system. So what we need to do, go beyond individual and community to reach the national and global levels. So there are different types of factors which are interdependent, like health of the individual becomes a direct function of people's own awareness and choices. When I talk about choices, it means the food choices, which they are considering important for them and for their family members. And unity of the community, particularly thinking about the people, thinking about the earth, thinking about the others who are vulnerable and their need of the food item. And this is the moment when individual and community efforts should be put forward to help those who are in need of food items. And definitely every government has tried to act according to their resources and according to their policies, according to their infrastructure. They have contributed and they are fully prepared to tackle this issue at a global level. So definitely it needs a global engagement. We need a global engagement amid this pandemic. So this, just to go through condition of I have just mentioned, because this type of information has already been presented by Nutritional. So I will just briefly discuss the vitamin A only, which is considered as important, and we are facing a severe deficiency around the world. And Pakistan is in severe subclinical condition in terms of vitamin A. And likewise, we have different nutritional challenges which are related to the minerals and vitamins. We have facing different poor diets. This problem was already discussed by Nuruddin, and that's the end of my talk. And if you have any question, you are most welcome.